In 1991, two hikers in the Alps found a body sticking out of the ice. They thought he was a recent climber. He wasn't. He was 5,300 years old. His name is Ötzi, the oldest preserved human ever found. When scientists examined him, they found something nobody expected: 61 tattoos, small black lines and dots scattered across his skin, but not randomly. They were clustered over his joints, his knees, his lower back, his ankles, and his wrists. When doctors mapped them, they noticed something. The tattoos sat almost exactly on the same points modern acupuncturists target for arthritis pain. And when they x-rayed Ötzi's body, they found severe joint damage in those exact spots. He had arthritis. And someone, 5,300 years ago, in the Alps, had marked his pain points with a needle and soot, then marked them again and again. This wasn't decoration, it was treatment. The oldest medicine in the world wasn't a drug, it was a map, drawn on a body. And it gets stranger. Across Europe, South America, Africa, and Asia, archaeologists kept finding skulls with holes in them, round holes, neatly cut into the bone. At first, they assumed it was injury, a club, a rock, a fall. But the cuts were too clean. In 1865, a French scientist examined one of these skulls and noticed something disturbing. The edges of the hole had healed. New bone had grown around it, which meant the person had survived, sometimes for years. The procedure is called trepanation, drilling a hole into a living person's skull. The earliest examples are 7,000 years old. And here's what nobody wants to believe. The success rate was high. Studies of these skulls from Peru show 70 to 80% of patients lived. In some places, over 90%. In 1800s European hospitals, the same operation killed almost everyone who got it. Stone Age doctors had better outcomes than 19th century surgeons. Why did they do it? For headaches, for seizures, for head injuries, for things they believed were spirits trapped inside the skull. Some patients had multiple holes, drilled, healed, then drilled again. This wasn't ignorance, this was surgery. But the most important thing they figured out wasn't surgery, it was chemistry. For thousands of years, across cultures that had never met, healers used the bark of one specific tree to treat fever and pain. The Sumerians wrote about it on clay tablets 6,000 years ago. The Egyptians used it. Hippocrates, in 400 BC, told his patients to chew it for joint pain. The tree was the white willow. In 1897, a German chemist turned willow bark into a pill, you know it, as aspirin. The most used drug on Earth is a tree your ancestors were chewing 6,000 years ago. The same pattern shows up with honey. An Egyptian medical text from 1600 BC tells doctors to pack open wounds with honey. For a long time, modern science called this superstition. Then, in the 1990s, researchers tested it. Honey kills bacteria. It dries out wounds, starves microbes, and slowly releases a natural antibiotic. Today, hospitals use medical-grade honey to fight infections that regular antibiotics can no longer kill. The cure is 4,000 years old. They didn't have chemistry, they had time, and they used it. But the strangest part of ancient medicine isn't the surgery or the drugs, it's who was performing them. Every culture on Earth, without contact between them, developed the same role. We call them all shamans now, healers who saw illness as imbalance between the body, the community, and the unseen world. For a long time, modern medicine dismissed shamanism as ritual nonsense. Then anthropologists actually watched what shamans did. They set bones. They gave plant medicines refined over generations. They calmed birthing mothers. They led rituals that lowered the patient's stress and built deep social trust. Researchers who studied healers across dozens of traditional societies found something remarkable. Shamanic healing produced real, measurable effects on the body. Heart rate dropped, stress dropped, pain dropped, wounds healed faster. The shaman wasn't faking it. The shaman was running the most powerful tool in medicine, the placebo. Except this placebo only worked because the patient trusted the healer completely. Modern medicine spent 2 centuries trying to remove the placebo from the equation. It can't, because the placebo isn't an error. It's the part of healing the shaman understood first. And it only gets better. In 2004, doctors in the United States approved a new treatment for the worst kinds of wounds. The treatment was maggots, the larvae of a common green fly. The maggots eat dead, infected tissue. They leave healthy tissue untouched. They release enzymes that kill bacteria. They make wounds close faster. Mayan healers used maggot therapy 2,000 years ago. So did Aboriginal Australians. American Civil War surgeons noticed that wounds full of maggots healed better than wounds kept clean. After antibiotics were invented in the 1940s, doctors threw the practice away as primitive. Then, antibiotics started failing, and modern medicine quietly went back to the maggots. This is the pattern. Aspirin came from willow. Wound honey came from Egypt. Maggot therapy came from the Maya. Acupuncture is older than written history. Modern medicine isn't replacing ancient medicine. It's catching up to it. For 200,000 years, humans had no doctors. They had healers who tattooed pressure points, who drilled holes in skulls and got their patients to walk out alive, who chewed bark that we now mass-produce in factories, who used cures the Egyptians wrote down 3,600 years ago, and who understood something modern medicine is still relearning, that the body and the mind heal each other. The pill in your cabinet is a Stone Age decision. The honey on your toast was once a wound dressing. The acupuncturist down the street is doing the same thing someone did to the man in the ice 5,300 years ago. We didn't replace ancient medicine. We renamed it. Every pill you take is a story. Someone tried it. Someone watched what happened. Someone remembered. You inherited their medicine. You just forgot whose it was.